All right, welcome to our fourth unit, the physical development of preschoolers. The essential question of this unit is how do growth and development changes in preschoolers support a vast expansion of their motor skills, and how can parents ensure optimal physical development? Okay, so section 1 is the growth and development of preschoolers. After studying this lesson, you should be able to describe the major changes in brain development during the preschool years, list the major changes in the heart, airways, stomach, and bladder, and describe changes in the skeletal system, as well as summarize major changes in gross and fine motor development during the preschool years, and explain how hand preference develops, and give examples of physical developmental milestones children might achieve in the preschool years. During the preschool years, the brain is still the fastest growing organ. Because of its rapid growth, it uses 30% of the body's energy, which makes good nutrition a must for healthy development. By 5 years of age, preschoolers' brains are 90% of their adult weight. Boys have larger head circumferences than girls. The following 3 major developments occur in a preschooler's brain. 1. Functional specialization, the development of special abilities in different regions or areas of the brain. For example, different areas of the brain will store long-term memories and use memory to retell or tell stories or events. Functional specialization of the brain enables people to develop executive functions, like working memory, cognitive flexibility, and inhibitions, control their negative emotions, handle expressive, speaking or writing, as well as receptive, listening and reading language, and allow for more logical concept development. Greater myelination is the second change, and it improves visual motor coordination and intellectual development. And the third change is pruning occurs in unused connections and thus begins to close many windows of opportunity. Besides the brain, other organs are also maturing. As the heart matures, heart rate slows and becomes steady. Blood pressure increases. By 3 years of age, children use adult-like chest breathing. Children's air passages, however, are small. They have large tonsils and adenoids, which are lymph node tissues. By 4 years of age, the stomach capacity of a preschooler is about a half of the adult stomach. Preschooler stomachs are straight and upright, making it very easy to vomit. The stomach lining is easily irritated by too much fiber or spices. Digestive upsets are also caused by viruses and bacteria. Dehydration is common in the preschool years. The preschooler's bladder is also maturing. Because they have better control over their bathroom needs, there are fewer trips to the bathroom and there are fewer accidents. Preschoolers grow more slowly than toddlers. The growth rate slows down for most children at approximately an equal rate. This means children who are larger than their peers at 3 years old are likely to be larger at 5 years too. In addition to changes in height and weight, changes also occur in preschoolers' body proportions, their bones and teeth, and their fat and muscle. Although growth slows during the preschool years as compared to their first 3 years of life, preschoolers are not finished growing. In the preschool years, height increases about 7 inches and weight increases by about 13 pounds, or approximately 3 to 5 pounds a year. 75% of preschoolers' weight gain is due to their muscle development. The height and weight norms of children from 3 to 5 ages. In age 3, boys are typically 38 inches tall and girls are just a little bit shorter at 37 and a quarter. Boys typically weigh 32 and a fourth pounds and girls weigh 31 and 3/4. At 3.5, they are 39 and a fourth inches tall, boys are, and girls are about the same. And then their weight in pounds are very similar at 34, 34 and a fourth. At age 4, boys are typically 40, almost 41 inches tall, where girls are about 40 and a half. And their weight in pounds are about 36 and a half for boys and only 36 and a quarter for girls. At 4.5, boys are typically and girls are typically both 42 inches tall and 38 and a half pounds. At 5, boys are typically a quarter inch taller at 43 and a quarter inch tall than girls, and they weigh typically a half pound more at 41 and a half pounds. At age 5.5, boys are typically 45 inches, while girls are 44 and a half, and boys are typically 45 and a half pounds, and girls are only 44. As toddler features begin to disappear, their body becomes taller and leaner, and their body proportions begin to look like more of those of an adult. The lower face grows more rapidly than the head, resulting in their face looking more like an adult's. Until 30 months, a child's waist, hips, and chest measure about the same. By 5 years of age, the waist is smaller than their shoulders and hips. The preschooler's trunk and legs also grow to resemble adult proportions. The trunk grows to allow more space for the internal organs, their heart, their lungs, their liver, and others. As their trunk grows, the abdomen protrudes less. The legs grow rapidly too. By 5.5 years old, most children's legs are about half the length of the body, which is the same as an adult's leg to body proportions. Preschoolers' bones continue to ossify and grow larger and longer. Their deciduous or baby teeth begin to fall out between 4 and 5 years of age. Although permanent teeth may not erupt until the early school age years, they are growing under their gums. Their jaw lengthens to accommodate these teeth. Tooth decay is also very common during the preschool years. Proper care of teeth is very important for lifelong dental health. During the preschool years, bone and teeth development can be harmed by malnutrition and other health problems. Bones, muscles, and joints are more prone to injury in preschoolers than in older children. There are two main reasons for this injury. First, their ligaments, which are the elastic-like bands that hold their bones together, are very loose and their bones are not fully formed. They're thinner and less hard than teenage bones, which causes injuries, such as some bones are prone to slip out of place. Second, certain diseases like osteomyelitis, which is an infection of the bone, childhood diabetes, Down syndrome, obesity, and sickle cell anemia can all lead to bone and joint deformities and increase the severity of injuries. The ratio of fat to muscle tissues continues to decrease slowly during the preschool years. Boys lose baby fat more quickly than girls. With good nutrition and physical activity, most of the baby fat disappears by the first day of kindergarten. At 5.5 years, a child's fat deposits are less than half as thick as they were at 1 year of age. Girls will have more fat than boys. As preschoolers' skeletal muscles and bones are made stronger by ossification, their bodies are strengthened. Muscle fiber, which is mainly water, is now being replaced with more protein. Preschoolers' activity levels also affect muscle development. Besides protein content changes in muscle tissues, the fiber size of muscles responds to physical activity. Thus, the 3-year-old skeletal muscles develop rapidly because children are more active at this age than any other age in the lifespan. Boys have more muscle and bone growth than girls. Because boys have greater muscle development, they are on average a pound heavier than girls their age. Preschoolers' motor development improves due to physical activity and increasing body growth and development. Preschoolers have an increase in muscle development and develop better balancing skills. Their eye-hand coordination becomes more refined. Their reaction time, or the time required to respond to a sight, sound, or other stimuli, becomes shorter. Preschoolers are able to perform many physical activities. Through play, their gross and fine motor skills develop quickly. As preschoolers' large muscles develop, balance develops too. This complex skill requires coordinating signals from the eyes and the movement of fluids in the semicircular canals of the inner ears. These signals are sent to the brain and then transmitted to the muscles of the body. Based on these signals, the muscles make constant adjustments to maintain balance, which keeps a person upright and affects many gross motor activities. A person's ability to maintain balance is also a measure of their eye, ear, and brain health. During the preschool years, children differ widely in their balancing skills. Through regular physical activities, children develop two types of balance. Dynamic balance, or the balance maintained while moving, develops when preschoolers walk in a line or on a balance beam. Static balance, or balance maintained while being still, develops when preschoolers stand on one foot with their arms outstretched or folded across their chest. Dynamic balance is easier to develop than static balance. You may realize this if you've ridden a bicycle or watched or participated in dance or gymnastics. Through muscle development and balancing skills, preschoolers become stronger and more coordinated. Preschoolers walk more smoothly than toddlers and like to try more challenging ways to move. They run faster, and their arms and legs alternate in rhythm. 4-year-olds use a forward arm action to jump higher. With increased courage and better balance, climbing becomes easier. They can catch balls better when they are bounced to them rather than thrown to them. 3-year-olds begin hopping, but older preschoolers can hop and skip faster and for long distance than younger preschoolers. Older preschoolers' actions become more advanced in all areas. 2 new actions, body rotation and weight shift, help their throwing ability. Body rotation is the action of turning their hips and then shoulders backwards while their throwing arm comes forward. Weight shift is the change of weight from the back leg to the forward leg, which is done by shifting the hips forward. Body rotation and weight shift may begin during the 3rd year, but both become much more pronounced by the end of the preschool years. Refinement of these skills continues for many years, with athletes able to do both actions at the same time. This creates a 20 to 30% increase in the force of their throw, while allowing the arm and hand to mainly direct the throw. Preschoolers' ability to manipulate or work with an object by using the hands is still awkward. As they play with small objects, however, their small muscles develop and their eye-hand coordination improves, which strengthens their fine motor skills. Preschoolers' fine motor skills change and develop over time. At 3 years of age, children can easily feed themselves using a spoon and fork, but they are still rather messy. They can build towers from small blocks, although the towers may be crooked. 3-year-olds can also draw straight lines and roughly copy circles. They can unbutton buttons and pull large zippers. By 4 years of age, preschoolers' movements are steadier. In addition to using forks and spoons, they may try to use knives designed for children when they feed themselves. They are able to build straight towers and place blocks with steady hands. 4-year-olds begin to cut along lines with round-tipped scissors. They can also comb their hair, wash their hands, and begin to lace, but probably will not tie their shoes. At 5 years, hand-eye coordination is greatly improved. 5-year-olds use a spoon, fork, and knife to feed themselves. They can build towers and play with other small toys with skill. They can make simple drawings freehand. 5-year-olds can also fasten large buttons, work large zippers, and may even be able to tie their shoelaces. So choose one of the fine motor skills we just talked about and how it develops between 3 and 5 years of age. So pick that out and think about it. What changes they go through. During the preschool years and sometimes during late toddlerhood, children begin to show hand preference. Hand preference is a tendency to use one hand more skillfully than the other hand for most tasks, making this the dominant hand. Hand preference is also called handiness or hand dominance. Most people think of hand preference in categories: right, left, and ambidextrous, or the ability to use the right or left hand as the preferred hand almost equally well for many tasks. Today, many researchers see handiness on a continuum with preferences in varying degrees. Generally, hand preference is not firmly established until the end of the preschool years. During this stage, the brain specializes and myelination allows for better connections between brain areas. This is needed for hand preference. Child development experts believe that other factors such as genetics, birth trauma, and social pressures also affect hand preference. Because researchers believe hand preference is determined by brain wiring, they feel each child should determine his or her own hand preference. Adults can help very young children develop hand preference by placing or holding objects at a child's midline, or the center of their body, rather than to the right or left of the child. This gives the child an easier choice in hand use. Adults can also encourage activities that require the use of both hands for doing different actions, such as bead stringing. Preschoolers need ample time for brain wiring to determine their hand preference. Adults should never force a change in preference. Physical capabilities greatly expand during the preschool years. Children are better able to explore and interact with the world around them. Preschoolers need support as they grow and develop physically. Parents and caregivers can support their growth and development through proper nutrition and a healthy diet. We will go over some of the physical milestones of preschoolers, but here are a couple. At what age can children ride a bicycle with training wheels? By 5 years. At what age can they walk upstairs with alternating feet? 3 years. At what age can they walk a balance beam? 4. All right, thanks for listening, guys. This is the end of this first section.